Hello everyone. I will be talking about how preventive measures can be taken to ensure protection from cholera disease. Treating cholera can be a tremendous task, but when proper preventive measures are taken to prevent cholera, it can be easier to withstand the disease rather than to treat the disease. The methods of preventing cholera are quite simple, especially for those who live in environments where the risk of cholera is low. However, even in areas where epidemic cholera is at a high risk, people can take preventive measures that can decrease the chances of contracting cholera disease. In this video, I will be discussing 4 most effective measures in preventing cholera disease. The first method is to drink and use safe water. If tap water is not safe to drink in your area, using bottled waters with unbroken seals and even carbonated water is safe. We use water in many ways that we may not realize. For example, when we use ice, preparing food, keeping our bodies healthy, brushing our teeth, and so forth. If the option of using bottled water is not available to drink, we can bring water to boil for at least 1 minute, and that can be safe to drink. The option of using a chlorine product or a household bleach is an option for using safe water. However, there is a word of caution. When using these chemicals, it is absolutely necessary to follow safety guidelines on following instructions when using chemicals to clean water. Chemicals can do more harm than good if the user of the chemicals is not utilizing the chemicals properly. More about using safe water is to always store your treated water in a clean and covered container. Never leave water in an open area or in open air, as the water may attract other substances in the environment. The second method that helps prevent cholera disease is washing your hands often. More specifically is when you wash your hands. It is important to wash your hands before you eat and throughout the duration of the time you are preparing food. It's also important to wash your hands before feeding children, after using the toilet, when in contact with feces, like cleaning someone's bottom, and during and after taking care of a sick person. The situations I briefly listed are not the only situations when it is important to wash your hands. However, the situations I mentioned are one of the most important times when it is vital to wash your hands. The third measure of preventing cholera is catered more toward areas where the use of a toilet may not be available. It is important to use latrines when defecating, and if latrines are not available, the option of burying your feces is the safest way to decrease the risk of contaminating other people. Where you choose to bury your feces is important to the environment and the people in the surrounding area. Public health officials have taught that in order to prevent large bodies of water being contaminated, feces should be buried 30 meters or 98 feet away from the bodies of water. The use of a composting toilet has reached areas where there is a high risk of cholera. Details on how a composting toilet works and the benefits of this practice will be further explained in the last and third part of this video. In short, feces are used as compost when using this composting toilet, and are put in pits with specific measurements that can safely decontaminate the feces and can actually become beneficial for the environment. The last method to prevent cholera that I will be talking about is the proper use of food. It is vital to keep food at their appropriate temperatures, because when food is allowed to stand in temperatures not meant for the specific food, bacteria can contaminate the food. And likewise, the consumer. Boil and cook food at the correct temperature. It is important to keep special foods separated that may pose a risk of getting contaminated. For example, meat cannot touch uncooked meat cannot touch ready-to-eat vegetables, or the vegetables will be contaminated from the bacteria in the uncooked meat. One food in particular needs to take extra precaution when consuming. This is seafood, in other words. Seafood lives in a variety of environments where they are susceptible in contracting compounds that are dangerous to humans if consumed. The methods I have talked about in this section of the video all help in preventing humans from contracting the bacterium Vibrio cholerae, which is the cause of cholera disease. If these proper measures are placed in your daily lives, it will greatly decrease the risk of contracting cholera disease.